Welcome. In the following presentation, you will be demonstrated a scenario where a patient comes into the hospital with a tooth abscess that radiates to the brain. Before we begin, it is important to note that bacteria in the teeth is kept under control by the body's natural defenses and proper dental hygiene, such as brushing and flossing. Without the proper dental hygiene, bacteria can grow up to the point where it can cause tooth infections such as tooth decay and gum disease. Many people are unaware that poor oral health can have detrimental effects on other areas in the mouth, such as diabetes, the heart, and pregnancy.
What do we have? 18-year-old male presents with general weakness on the right side, headaches, nausea, and change in vision.
My name is Dr. Fernando. We're going to do everything possible to assist him. First, I'm going to need some history.
Yes, doc. So recently I've been feeling very weak, and on one side it's been hurting a lot more than usual. I've been experiencing extreme nausea, and today when I woke up, my vision was blurred and I wasn't able to see as clear as I usually can.
Okay, Mr. Klein, we're going to run some tests to figure out what's wrong. Let's run some blood tests and test for any infection, an MRI, and a CT. I want to rule out possible brain abscess. You paged?
Yeah, the results are bad.
Is that his tooth?
Yeah.
This patient has an abscess in his tooth that spread to his brain. We need to get him to the OR fast. Mr. Klein, has your tooth been hurting or bothering you?
Yes, doctor. I cracked my teeth about 2 weeks ago.
Have you gotten any treatment for it?
No, I don't have enough money for a root canal, so I just thought it would go away on its own.
Mr. Klein, unfortunately, due to the lack of you getting a root canal, this has caused for an infection in your tooth, which allowed an abscess that traveled up to your brain. I'm very sorry, but you need surgery right now.
Surgery? Brain surgery? What does this have to do with my tooth?
Mr. Klein, unfortunately, the abscess in your tooth traveled through your blood up to your brain, and now you have this abscess in your brain.
What is a brain abscess?
A brain abscess is a pus-filled swelling in the brain. It usually occurs when bacteria or fungi enters the brain tissue after an infection or severe head injury. A brain abscess is regarded as a medical emergency. Swelling caused by the abscess can disrupt the blood and oxygen supply to the brain. There's also risk of brain damage, mild to moderate, epilepsy, and meningitis. Our biggest concern right now is the abscess bursting. If left untreated, a brain abscess can cause permanent brain damage and could be fatal, which is why we need to take you to surgery right now.
The outcome of this situation would have been completely different if the patient had received the proper dental care and avoided this life-threatening situation. It is important that if you're feeling discomfort, bleeding of the gums, swelling outside and within your mouth, blisters or ulcers that don't heal, changes in texture and color of your soft tissues, please see your dentist.
All of these symptoms could indicate possible life-threatening diseases such as chronic gum disease or oral cancer. This is all due to a poor oral health.
It is important to brush for at least 2 minutes twice a day with a fluoride toothpaste. Flossing daily and visiting your dentist for checkups and dental cleanings every 6 months are all aspects of proper oral health.
Diet is just as vital as exercise. Sugar consumption should be kept at a minimum, while alcohol can be kept in moderation. Smoking, as well as other tobacco usage, should be avoided.
And remember,
Good oral health is good overall health.